Hello friends, welcome to Shri Netralaya. In this video, we will again see a case of very hard cataract, grade 5, and it is managed with a ultrasonic pre-chopper. You can note the grade of this cataract is very hard. The surgery started with 2.6 mm incision for main port and 23 gauge side port. Anterior capsule is stained with trypan blue and trypan blue is washed away now. This is a real-time phaco emulsification procedure, so I have not done much of a cutting job, and you can see the timer running on the left upper quadrant. Anterior chamber is formed with viscoelastic. Many times I have shown the arrangements which I use for this type of technique, and I will just discuss that once more. Here I have taken a 5.5 mm Rexis marker, and Rexis is completed with a cystitome needle. I will definitely recommend to have a slightly larger Rexis of 6 mm or 6.5 mm whenever you are having a very hard cataract and planning a ultrasonic pre-chopper, so that you get more space for maneuvers. After CCC, hydro is performed and anterior chamber is again formed with a viscoelastic material. First thing first, I need more space, so I am just debulking the nucleus so that I get more space for following maneuvers of ultrasonic pre-chopper, so that my left hand instrument as nucleus sustainer can go comfortably inside and have space to manipulate the nucleus without causing any stress on the zonules. Once the nucleus is debulked, this is done with a regular phaco machine. Here I am using Infinity for regular phaco and AMO Sovereign compact machine with ultrasonic tip by Dr. Neha Dholakia. The tip was introduced as a IOL cutter, and we have extended its use as nucleus cutter for ultrasonic pre-chopping. Now the point to be noted is how I have entered my left hand into the bag. I have made it slightly lateral and then entered inside. You can see it is not a tough job. Once the two pieces are done, my AC is slightly shallow. So to play safe, I want to form the anterior chamber again and go with the second chop. Again I am slightly debulking the nucleus so that I get more space for maneuvers. Anterior chamber is formed with viscoelastic. See how I am entering my left hand and holding the equator of a nucleus so that I get a good hold. I am not pulling my left hand towards center, rather I am pushing my right hand towards periphery and using a ultrasonic power to do that, and not pushing with a mechanical way. Adjusting the microscope to have a better view. I have a power of around 40 here, and ultrasonic pre-chopper is used to divide the nucleus into multiple pieces. Those people who are used to with the horizontal chop technique for phaco emulsification, they find it easy to enter to the equator with a left hand instrument, but for those who use a vertical chop, they use a central part of nucleus to divide it further, so they may find it difficult, and this may be a learning curve for them. See how easily the nucleus is cut into multiple pieces, here into 8 pieces. very comfortably without causing any stress on the zonules. Just be careful that you are not touching the bag or not pulling the bag to the center, and making sure you are in the bag with your left hand. Once this is done, a regular phaco machine come into picture, and these pizza pie 8 pieces are taken one by one into the iris plane and taken out with phaco emulsification. Here I am using a torsional phaco. The advantages of torsional phaco are definitely there over longitudinal while eating up a hard nuclei. But to use ultrasonic pre-chopper, we use a longitudinal phaco only, because the tip is straight and torsional will not work with straight tip. So if you have machines like Legion, Centurion, you put IP mode off, that is intelligent phaco mode off, and torsional mode 0, torsional power 0, with a longitudinal power of 40 to 60 according to the grade of cataract. Rest of the settings can be kept same. Vacuum doesn't make much of a differences. I have tried it because there is no lumen to the tip, so vacuum, even though you keep or don't keep, that is not going to work. Before finishing off the last pieces, I definitely want to fill up the anterior chamber with viscoelastic and take these last pieces very carefully so that I should not have any shallowing of the anterior chamber. See how nicely the case is completed without causing much damage to the endothelium, and the safety of bag is definitely taken care by the ultrasonic pre-chopper. Cortical material is washed off. Again, anterior chamber is formed with viscoelastic and the IOL is injected. You can note I have completed this case in a real time of 10 minutes and 30 seconds approximately. So the duration taken for all this is not much, but it has a learning curve. So definitely try this with ultrasonic pre-chopper needle. Do subscribe to a YouTube channel Dr. Pankaj Lande for more such exciting videos. Thank you and good day.